Did you know your heart might be trying to warn you about something serious right now? Stay with me to discover the 5 key symptoms of cardiac arrhythmia you should never ignore. Hey there, everyone. I'm Dr. Williams, a cardiologist and pacemaker specialist. I've spent years studying heart rhythm disorders, and today I'm excited to share some vital information with you. We're talking about cardiac arrhythmias, conditions where your heart beats too fast, too slow, or irregularly. Some arrhythmias are no big deal, but others can be serious, especially for those of us over 40. Knowing the signs can make all the difference. So let's dive into the 5 symptoms that could point to an arrhythmia, plus a bonus one you'll want to hear about. What is arrhythmia? First, let's break it down. What is a cardiac arrhythmia? Your heart has a natural pacemaker that keeps it beating steadily, usually between 60 and 100 times a minute when you're resting. An arrhythmia happens when this rhythm gets out of sync. It might race, slow down, or skip beats. Research shows that arrhythmias affect over 2% of people, and the risk goes up as we age. While some are harmless, others need medical attention, so recognizing the symptoms is key. Symptom 1. Palpitations. Symptom number 1. Palpitations. This is when you feel your heart racing, pounding, or fluttering, like it's doing somersaults in your chest. It might feel like your heart skips a beat, or beats too fast. Palpitations can last a few seconds, or, in some cases, go on for hours, or even days. They might come with dizziness or a tight feeling in your chest. Now, things like stress, too much coffee, or exercise can cause palpitations, and that's often normal. But if they happen often or feel intense, it could be an arrhythmia. To check, try taking your pulse when it happens. A normal resting heart rate is 60 to 100 beats per minute. If yours is way off, it's time to talk to a cardiologist. We can use an electrocardiogram or ECG to catch the issue if you're feeling it during the test. If it's off and on, a Holter monitor, a device you wear for 24 to 72 hours, can record your heart's rhythm. I've reviewed over 20,000 Holter reports in my career, and they're a game changer for spotting arrhythmias. Symptom 2. Fainting or feeling faint. Next, symptom number 2. Fainting or feeling like you're about to faint. We call this syncope or presyncope. Fainting happens when your brain doesn't get enough blood, causing you to lose consciousness briefly. It's like your body just shuts off for a moment. You might feel weak, see spots, then wake up on the floor. Presyncope is when you feel lightheaded but don't fully pass out. Arrhythmias can cause this because an irregular heartbeat might not pump blood effectively. For example, I had a patient who kept fainting when he stood up after sitting for a while. Tests showed his heart rate was dropping too low due to an arrhythmia. Most fainting isn't dangerous, but some arrhythmias that cause it can be serious, even life-threatening in rare cases. If you've fainted or felt close to it, see a cardiologist right away. Have you or someone you know ever fainted? Drop your story in the comments. It might help others know what to watch for. Symptom 3. Shortness of breath. Symptom number 3. Shortness of breath. This is when you feel like you can't catch your breath, even when you're not doing much. Severe arrhythmias, like atrial fibrillation, can make your heart pump less efficiently, causing fluid to build up in your lungs. That makes breathing feel heavy or labored. Shortness of breath is a red flag because it's not just about arrhythmias. It could point to other issues like heart failure, a heart attack, or lung problems like pneumonia. I get asked a lot in my clinic, is it normal to feel out of breath? No, it's not. If you're struggling to breathe, especially with a racing heart or chest discomfort, get it checked out. For instance, if you're sitting on the couch and suddenly feel like you've run a marathon, that's a sign something's off. Always see a doctor to figure out the cause. Symptom 4. Slow heartbeats or pauses. Symptom number 4. Slow heartbeats or feeling like your heart pauses. This is called bradycardia, where your heart rate drops below 60 beats per minute. For some folks, like athletes, a slow heart rate is normal. But for others, it can cause tiredness, weakness, or even fainting. You might feel like your heart stops for a second or two, which can be scary. If you check your pulse or use a pulse oximeter and see your heart rate is, say, 35 beats per minute, that's a sign to see a cardiologist. Bradycardia can happen because of a heart block where the electrical signals in your heart get delayed or blocked. This might be due to aging, medications, or past heart issues like a heart attack. I've seen patients who felt fine in the ER with a normal ECG, but later, a Holter monitor showed a serious block that needed a pacemaker. So, if your heart feels too slow or you're feeling off, don't wait. Get it evaluated. Symptom 5. Chest pain. Symptom number 5. Chest pain. Let me be clear. Any chest pain needs to be checked out. No exceptions. It could feel like pressure, a sharp stab, burning, or tightness, and it might spread to your arms, neck, or back. In arrhythmias, chest pain can happen if your heart is working too hard or if there is another heart issue like blocked arteries. Chest pain is also a warning sign for heart attacks, especially if it comes with shortness of breath or sweating. I can't tell you how many times patients ask, "Is chest pain normal?" It's never normal. If you feel it, head to the ER or call your doctor right away. In the hospital, we'll do an ECG, check your heart enzymes, and give medications if needed. Some arrhythmias can even start during or after a heart attack, so don't ignore this symptom. Before we get to the bonus symptom, I've got a quick request. If this video is helping you understand your heart better, please hit that subscribe button and turn on notifications. It means the world to us and helps us keep bringing you important health tips like these. Bonus symptom: dizziness. Now, the bonus symptom, dizziness. Feeling dizzy or lightheaded can happen when your heart isn't pumping blood well, which is common in some arrhythmias. It might feel like the room is spinning, or you're about to lose your balance. In serious cases, the heart might quiver instead of beat, reducing blood flow to your brain. This can lead to dizziness, feeling faint, or even fainting. Dizziness alone might not mean an arrhythmia. It could be dehydration or low blood pressure. But if it's frequent or comes with other symptoms, like palpitations, get it checked. Keeping a note of when you feel dizzy and what you were doing can really help your doctor figure things out. So, let's recap. The 5 main symptoms of cardiac arrhythmia are palpitations, fainting or feeling faint, shortness of breath, slow heartbeats or pauses, and chest pain plus dizziness as a bonus. If you notice any of these, don't brush them off. Write down when they happen, how long they last, and what you were doing. Then see a cardiologist. Tests like an ECG or Holter monitor can help us spot the problem. Most arrhythmias I see in my clinic are manageable with follow-ups or medications, but some need more, like a pacemaker. Early detection is everything. This video is for information only. Always talk to your doctor for medical advice. If you found this video helpful, please give it a thumbs up, share it with friends or family, and leave a comment with your questions or experiences. Want to know more about pacemakers or other heart topics? Let me know in the comments. I read them all. Subscribe for more heart health tips, and I'll see you in the next video.
Thanks for watching, my friends. Take care of your heart, and I'll catch you next time.